you're having mid-back pain right here between the shoulder blades, listen up, I have a couple exercises for you. I'm Dr. Will from Miami Spine and Performance in Hollywood, Florida. Today we're going to talk about a couple of things you can do with very minimal equipment to get rid of that nagging mid-back pain between the spine and the shoulder blade. Pretty much every patient I have that comes in, regardless of if it's an ankle sprain, if it's headaches, if it's low back pain, for some reason that area between the spine and the shoulder blade is just full of trigger points, it's just uncomfortable, and they usually feel it throughout the day. So I'm going to give you guys a couple of ways that you can fix that at home on your own. So the first one is going to be an exercise that we're going to do to mobilize the mid-back. So a lot of that issue there actually comes from stiffness in the spine. So we're going to use a foam roller, but I'm not going to roll up and down like you would traditionally. I'm just going to extend myself over the foam roller and reach. Okay, so I'm going to get right in between the shoulder blades and reach. If you have a little bit of extra equipment, like something like a kettlebell, you can add a little bit of load to this. So I'm going to let the kettlebell kind of draw me back, and I'm going to come forward like that. Okay, and even resting here on the foam roller, you'll probably feel a couple of yucky spots where there's some tightness in that mid-back. And you want to try to avoid flaring the ribs out too much, so if you can keep the ribs down and extend over, that's even better. Okay? So that's number one. That's going to help us get some extension so that we don't get stuck in this kind of forward posture where these muscles between the shoulder blades end up being stretched out and weak. Number two, we're going to use the same foam roller here, and I'm going to use it for a side-lying open book. So this is one of the most common exercises I use here in the office. I'm going to follow my hand with my eyes and rotate over. So the purpose of this exercise is not to open up the chest as much as it is to rotate the torso. So I'm trying to point my sternum up towards the ceiling and open up. And this thoracic rotation, so that rotation through the mid-back is often very, very locked up. So this is a great way to just kind of attack that area. It's a very relaxing exercise. Usually you'll feel a stretch in the glute and the low back as well. And just like everything, we're going to try to do this on both sides. So we're going to rotate just like so. Open, I'm going to follow my hand. And usually you'll notice a different side to side. One will be tighter than the other. We're just going to open up like that. Okay, guys? So that's number two. Again, so far all we've been using is a foam roller, so minimal equipment needed. We start with extension, then we get rotation. Number three, all you need is any resistance band. It's not even that important whether it's a tube, whether it's a band, whatever it is. It just needs to have some elasticity to it so you can get some strength training in. Now, typically when people do band pull-aparts, they'll go palms down like this, okay? And there's nothing wrong with that exercise. It's a great exercise. However, I do prefer palms up if you're trying to use it to strengthen the shoulder blades, because what that's doing is it's setting the shoulder into external rotation. So normally, you know, we're sitting here at the desk, at the steering wheel, at the dinner table, over the sink. Everything's kind of internal rotation, right? So it's our pecs, it's our anterior delts. And again, these muscles are getting deconditioned and tight. So what we want to do is we want to externally rotate. So I'm going to take this band, I'm going to go palms up. You can do this seated or standing. And I'm just going to pull the band apart all the way to my chest and come back. Really try to exaggerate the range of motion here. Keep those palms up. Squeeze the shoulder blades. You guys can see from the back here. So I'm letting my shoulder blades spread, and then I'm squeezing together as I pull those arms apart. Squeezing and pulling. So for those of you that haven't trained your mid-traps or your rhomboids, you're really going to get a good pump out of this, even just after a couple of repetitions, okay? So the final exercise we're going to do, again, we're back to our foam roller. So we're going to actually come in this room over here because you are going to need a little bit of wall space. This is a great exercise that I use with my patients that are dealing with shoulder pain, neck pain, thoracic outlet syndrome, anything like that. We're going to put the foam roller against the wall. We're going to put our arms like so, and then I'm going to reach as I keep my arms against the foam roller, just like that. And come all the way up and all the way down, okay? So I'm keeping pressure on the foam roller. I'm keeping my thumbs pointed backwards, and I'm leaning into the wall, and then I'm falling back. And I'm leaning into the wall, and I'm falling back. So this is a great way to strengthen that a muscle called the serratus anterior, right, which is kind of that boxer's muscle, but also a great way to keep the shoulder blades nice and stable, right? So as we're working up and down, we're strengthening the muscles around the shoulder blade, which is going to help hold us together. So again, guys, we have the extension on the foam roller, rotation, we have our strengthening in this direction, and our strengthening in that direction. Try 2 or 3 sets of 10 to 15 of each of those, and I promise, not only are you going to feel less discomfort in your mid-back, but you're also going to feel a lot stronger, more mobile, and you're going to feel that you can hold your posture better throughout the day. So if you guys have any questions about those, let me know. And as always, if you are having pain, see a trained professional, get evaluated. These exercises are recommendations for somebody that might be sedentary or working at the desk a lot. You're starting to feel early pain, but if you are having discomfort, go see a professional, go see your local sports chiropractor, and let us take care of you. Thanks, guys.